Hi, I'm Art Kaplan. I'm at the Division of Medical Ethics at NYU's Grossman School of Medicine. Well, as we're starting to watch some fading in the number of hospitalizations associated with COVID and the beginning of the end of mask mandates, and generally people saying, I'm going back out to events, I'm going to go back to restaurants, I'm going to go visit friends, I'm going back to various sports venues or theater, I want normalcy. It may not be a bad time to take a little bit of a grumpy attitude and say, what did we learn so far about the response to COVID that were kind of our 10 biggest mistakes? And I think there are probably more than 10, but let's see what that list might look like, just so not only can we begin to debate how to correct what I think were errors and mistakes, but also to see whether we're ready for the next wave of whatever it is that might show up as a pandemic, either future COVID variants or flu variants or Ebola or Zika or some other horrible thing that might put American society and the world at risk. Well, the first thing I think we learned is language matters. I think in this whole debate about COVID and what to do, we heard terms like warp speed and terms like booster. Both of those terms, I think, were inaccurate. The suggestion that our vaccines were made at warp speed led some people to think, well, then they're not safe, or they're cutting corners, or the evidence isn't good. Politicians, from Trump to Biden, wanted to take credit for getting vaccines out there very quickly in response to the appearance of COVID. Understandable, but you can't go around describing medicines or vaccines as somehow warp speed or something that has never before been done at this rate. You scare people, and there's no reason to scare people. The evidence for COVID vaccines was solid, impressive, something that had been worked on in terms of basic science for many, many years. If there was a warp speed, it was because the manufacturers were given money to make the vaccines and have them ready to go as soon as approval came. Public often didn't understand that. Similarly with boosters, kept talking about the third shot as a booster. A lot of people hear the term booster and think, well, that's not something I need, or that's more voluntary. Look, the COVID vaccine is a 3-shot vaccine. It takes 3 shots to keep all the variants at bay, keep you out of the hospital, keep you from dying. By talking about boosters all the time, the CDC, many other government agencies, I think gave the impression that something really important was not. There was even a hint that we were giving out boosters while the rest of the world didn't get any shots. That's inaccurate. It's a 3-shot vaccine. The rest of the world needs 3 shots too. Everybody does. And by misdescribing things, calling them boosters when they weren't, rather than saying you've got a vaccine that requires 3 shots to be complete, I think we undermined both Americans' willingness to get that 3rd shot and set up a false scenario where the rest of the world was criticizing us, if you will, for indulging ourselves with boosters when they didn't have any vaccine. They certainly merit vaccine, but everybody merits a complete sequence of vaccination, the 3 shots. Every vaccinologist I talk to says it's a 3-shot vaccine. So this language of boosters really undercut what we could do. Another lesson we learned: the pandemic is as much about values as it is about science. It's really important to understand that some of our biggest failures in responding to COVID had nothing to do with lack of vaccines or an inability to prove that masks helped, or that testing was valuable in terms of trying to quarantine and isolate infected people, or that ventilation was important. I mean, the science, I think, was done very well and held up well. But what we never messaged very well was the ethics, was the values. When people said things like, I want to be free to go where I want and do what I want, even if it's a pandemic, That is not an acceptable interpretation of liberty. You don't get to go where you want, do what you want, show up where you want, if you're going to pose a danger to somebody else. It's very simple. Liberty gets restricted when the possibility is there that you could harm somebody else. So if you're going out infected, or you don't know your COVID status, which was true for a lot of people throughout the COVID epidemic, then you have a duty not to put them at risk. And we never sold that message effectively about the obligations to let liberty be tamped down or temporarily restrained to protect us. That's a fundamental goal of society. And by the way, a principle we follow when we say you have to have rules governing how you drive your car, you have to have rules governing putting kids in child seats. There are many, many parts of our lives where we restrict liberty so that we can have less mayhem and more, if you will, social activity permitted, more freedom by restricting things that people do. We don't say, you go out and pick which side of the road you want to drive on tomorrow morning, up to you. It's a liberty choice. Another major failure I think we learned about, we're not very good at communication within the medical and science communities to the public. I think there were many people who tried very valiantly to communicate messages to the public on mainstream media, social media, and they did their best. But the battle about COVID and getting messages across to fight misinformation about phony cures or the dangers of masks, that they're going to suffocate your children if you wear them, and many other powerful misinformation messages, they took place at the grassroots. The people who were peddling bunk showed up at the school board, showed up at the church, showed up at the synagogue, showed up at the high school, showed up at public meetings and public forums. It's great to have messaging top down and to be on the national media, send out messaging there, get things into major print outlets and social media outlets. But the battle in public health communication is grassroots up too. We need more people who are showing up at local forums, local activities, to really get messages across to the local community, answer questions, and also serve as trusted sources. Throughout the whole COVID epidemic, I think some of the most trusted people remain doctors and nurses, the personal people who had relationships with patients or that people knew. And that's where we've got to get more effective communication going, get those people out a little bit more locally. It isn't just top down. As much as everybody wants to pay attention to what Biden says or what Tony Fauci says or what pundits are saying on various TV networks, that's half of the messaging battle. When you don't fill in the other half, misinformation, bad information takes off, and it really hurt during the COVID epidemic. I think there was another myth that grew. We were betraying the rest of the world when the richer countries vaccinated themselves. It would be useful to get vaccine out as fast as possible around the world. It's prudent because we know that new variants can occur in unvaccinated places. And it's obviously important for humanitarian reasons to help save lives in places that have dangerous outbreaks of COVID or something else. But the world needs a better system to disseminate vaccines. It isn't enough just to send them on a boat to a dock. If the country where they arrive is corrupt and the leader's going to sell those vaccines to the highest bidder or some other country, if there's no refrigerators, if there are no roads, if there's no one trained to give the shots, if there's not even messaging that goes out to fight anti-vaccine misinformation in those countries, then vaccination isn't going to happen. It isn't as simple as just saying, give us the patents or give us the vaccine supply. We've got an infrastructure challenge in much of the world that has to be overcome in order to vaccinate. And let me add, there's plenty of places in the world now where no one's getting in to vaccinate. Think about Ukraine, think about Ethiopia, think about Yemen, think about Somalia, North Korea. There's a big list of war-torn states, failed states, where no one's going to be launching a vaccine campaign we've got to come up with other tools in order to battle COVID or any other outbreaks in those places. Well, my last on the top 10 list, although it's not really 10, is we didn't use all our tools. There was a big push trying to vaccinate our way out of COVID. Vaccines helped, but they're not enough. We never really pushed hard for testing. We wound up doing things like shutting down cities, shutting down entire schools if they had one case. The right way to go is to get testing out there, cheap, available, regular, every day, so that you could keep your child home if they were infected, rather than closing the whole school. Similarly with the workplace, the whole idea of quarantining and isolation, they're valuable, they're all public health tools, but in modern economies and modern society, they're not practical. Even the Chinese trying to shut down Shanghai and other huge cities are learning the bitter truth that it really isn't practical to shut down 26 million people in a city. You've got to test your way through, and we didn't pursue that option. And we didn't pursue the option of antiviral medicines. They were the tools that we used to get past HIV, and we didn't use them effectively. We didn't develop them fast enough. We didn't have protective gear. Inexcusable that we don't store it, maintain it, ventilators as well. A just-in-time system of supply might be useful for car manufacturers, but it isn't going to work in healthcare. We need a reservoir of backup so that if something breaks out, we can quickly disseminate the requisite protective gear, the requisite masks and gowns and so on. And lastly, ventilation. This is an airborne disease. It took us a long time to admit it, but we need to make sure that not only are we paying attention to deep cleaning, which I think didn't do much of anything, but really trying to get viruses out of the air, upgrading ventilation systems in schools, in workplaces, in hospitals, in nursing homes. That's something that is a weakness in our system, and we've got to fix it. So there were a lot of lessons forthcoming from the COVID experience that I think finger pointing might be appropriate, but hopefully not just finger pointing, trying to learn, improve, do better for the next pandemic. As the experts say, there will be a next pandemic, and hopefully what we did wrong or what we didn't do as well in this one, we can fix in time for the next one. I'm Art Kaplan at the Division of Medical Ethics at NYU Grossman School of Medicine.